Hello everyone, this is Dr. Audrey Tai. I'm a board-certified and fellowship-trained LASIK and cataract surgeon, ophthalmologist, and cornea specialist. Welcome back to my channel, Eye Channel by Eye Surgeon. Do you feel your eyes are often red, scratchy, and tired from time to time? You may even notice your vision gets blurry sometimes. If so, most likely you're suffering from dry eye disease. We're often told to use over-the-counter artificial tear drops to treat dry eye disease. But are those eye drops enough for you? What are the additional dry eye treatment options when the over-the-counter drops are just not enough? In today's video, we will go over the dry eye treatment options that target different causes of dry eye disease. This is not a sponsored video, and the treatment options I mentioned in this video are based on my own clinical experience. If your dry eyes are controlled with over-the-counter drops alone, I've made a video about my top 5 over-the-counter eye drops to help you find the right one for you. You can also find links below in the description section for the over-the-counter dry eye disease treatment options I mentioned in this video. If you find this video helpful, please don't forget to like and share this video and subscribe to my channel to help me bring you more videos about eye health and eye surgery. To learn more about my practice, you can follow me on Facebook and LinkedIn at Dr. Audrey Tai. To understand which dry eye treatment options are right for you, it is important to understand what type of dry eye disease you have. There are 3 main types of dry eye disease: evaporative type, aqueous deficient type, and mixed type. There are 3 different layers of the tear film: lipid layer, aqueous layer, and mucin layer. And each of the 3 types of dry eye disease is caused by a problem with one of the 3 different tear film layers. The evaporative type of dry eye is mainly due to problems with the lipid layer of the tear film, which is the outermost layer. Often the tear film is unstable and evaporates too quickly when the lipid layer is unhealthy. With the evaporative type, the eyes feel dry and irritated shortly after applying over-the-counter eye drops, and you may feel that you need to put in eye drops over and over again. The lipid layer of the tear film is secreted by the meibomian glands, located in both upper and lower eyelids. If the meibomian glands are clogged or not working, or the gland oil contains too much inflammatory particles, the aqueous layer of the tear film underneath, secreted by the tear glands, will not remain on the cornea for long enough to lubricate and moisturize the eyes. One effective treatment you can do at home to open up the oil glands is warm compresses. You can either just use a washcloth, soak under hot water, and wring it out and place over closed eyelids for about 5 minutes, once or twice a day. Or you can use a heat mask. You can microwave most heat masks for about 20 seconds and they will stay hot for 20 minutes. The heat will help open up the clogged oil glands. I've listed the heat mask that I have been using myself in the description below. For more severe blockage of the meibomian glands, you may ask your eye doctor about some in-office treatment options, such as eye locks or LipiFlow. They work like a more intense warm compress and are administered in the doctor's office to aggressively target clogged oil glands. The evaporative dry eyes can also be caused by unhealthy gland oil secreted by the meibomian glands. This is typically due to increased inflammatory particles in the tear film. In this case, it is important to modulate and restore the health of the meibomian glands and their oil. This is where omega-3 supplements can come into play. Because omega-3 supplements are not a prescription medication and are not regulated by the FDA, their dosage and composition may vary greatly. Stay tuned for an upcoming video where I will take a more in-depth look for you into omega-3 oil supplements for dry eye disease. I've put a link in the description below for one brand of omega-3 oil for dry eyes if you would like to check it out. Please remember to always consult with your doctor before taking any high-dose omega-3 supplements to make sure they're safe and right for you. The second type of dry eye disease is the aqueous deficient type. This type of dry eyes affects the aqueous layer of the tear film, which is made by the tear gland. When the tear gland does not produce enough tears, the surface of the eye, the cornea, which is the clear dome-shaped structure that functions as the windshield of our eyes, does not get adequately lubricated and moisturized. This type of dry eye disease needs to be treated with artificial tear eye drops. A lot of times, inflammation of the tear gland and the surface of the eye causes decreased tear production and low tear turnover. Your eye doctor may prescribe a mild steroid eye drop for a short period of time to decrease the inflammation on the surface of the eye and to improve tear production. Prescription eye drops containing steroids can have side effects if used long term, such as cataract formation and increased eye pressure. This is why steroid prescription eye drops are typically only used for a short period of time. There are 3 FDA-approved prescription eye drops which do not contain steroids. These drops have a good efficacy and safety profile and can be used long-term to treat dry eye disease. The 3 eye drops each work differently, and it is important to discuss with your eye doctor to see which one is right for you. Sometimes your eye doctor may consider placing plugs in your tear ducts to keep the tears in your eyes longer to treat aqueous deficient dry eye disease. For people who suffer from severe aqueous deficient dry eye disease, such as Sjogren's disease, even the treatment options I just mentioned may not be enough. In those cases, a special type of eye drop purified from the patient's own blood can be used to treat the disease and control the symptoms. They're called autologous serum eye drops. Your eye physician or cornea specialist can help you determine if your disease is severe enough to need serum drops. The last type of dry eye disease is the mixed type of dry eyes. And this is probably the most common type of dry eye disease. For a lot of people with dry eyes, both the lipid layer and aqueous layer of the tear film are unhealthy. People with mixed type may need a combination of dry eye treatments that I mentioned earlier, such as warm compresses and omega-3 oil supplements to improve the oil gland function, over-the-counter artificial tear eye drops, and prescription medications to control dry eye symptoms. It is important to remember there's no one-size-fits-all treatment protocol for everyone. In my clinical practice, I make an individualized treatment protocol for each patient based on their individual situation, and I tailor their treatment plan based on their response to each treatment option. In this video, I've mentioned some of the most common dry eye treatment options. There are also other, more invasive and advanced treatment options that are typically reserved for extremely severe cases. Dry eye disease is more common than we often think. It is estimated that more than 16 million people in the US suffer from dry eye disease. If you feel your eyes are still irritated or sometimes have blurry vision, despite using over-the-counter eye drops, it is important to have a full eye exam and talk to your eye doctor about what treatment options are right for you. Let me know in the comments below what dry eye treatments you are currently using and what your experience has been. I hope you'll find this video helpful. If you have learned anything new from this video, please don't forget to hit the like button and subscribe to my channel to help me bring you more videos about eye health and eye surgery. You can also follow me on Facebook and LinkedIn at Dr. Audrey Tai to learn more about my practice. Thank you again for watching, and I will see you in my next video.